Hello and welcome to Health Options. I am Uche Ugochukwu, standing in for your regular anchor, Rabi Abdallah. Statistics from the World Health Organization indicates that more than 1.5 billion people are living with ear problems and hearing loss globally, with nearly 80% of this population living in low and middle income countries. It also highlights that an estimated 135 million people have ear and hearing problems in Africa, projecting that the numbers could increase to over 338 million by 2050. Worthy of note, however, is the fact that over 60% of the common ear diseases and hearing loss can be detected and often managed at the primary level of care. What are the burning issues affecting patients? Do people with hearing loss know how and where to find help? What is the situation, the needed human resource for this area of care? These and more are issues we seek answers to as we focus on access to ear and hearing care on this episode of the program. Thanks for joining us. You will get to meet my guests shortly.
Hearing is a gift, yet some human actions are a threat to the ear and hearing ability. The ear gadget you use, such as earpiece, earbuds, headphones frequently, how safe are they?
That exposes the ear to very loud sound. Very loud sounds destroys the hair cells in the ear. You know, the part of the ear that you don't see.
Despite increased awareness like this, experts say there is a prevalence of hearing loss among young population.
When you speak to a child and the child doesn't respond or doesn't answer, doesn't obey, you tend to think that the child is very stubborn. But you should check the child's hearing. It may be that the child is not hearing well.
Do you know that Nigeria has ear, nose and throat ENT policy of 2018? The ENT policy is designed to, among other things, give access to ear care at all levels of health care. The 2023 World Hearing Day, the need for integrating ear and hearing care as an essential component of universal health coverage.
Countries can empower their primary healthcare workforce to better support people with ear and hearing problems. WHO calls on governments, health professionals, and civil society to work with us to champion a vision of accessible ear and hearing care for all.
Meanwhile, as you listen to that loud sound via your ear gadget, remember that hearing is a gift, and if lost, it may never be recovered.
If you're just joining us, this is Health Options, and our focus is access to ear and hearing care. Right here in the studio to take us through the topic is the Professor of Ear, Nose, Throat, Head and Neck Surgery, Professor Sunday Titus Ibekwe. He is the President, Foundation for the Sick and Health Education, and the Chair-elect, International Advisory Board, American Academy of Otorhinolaryngology. You're welcome, Prof.
Thank you for having me.
So now, according to the World Health Organization, more than 1.5 billion people are living with ear diseases and hearing loss in the world. What can we say is the cause of this?
Actually, ear and hearing care is a very important part of living. And it all starts right from conception. During the course of development of fetus or baby. Anything that goes wrong during this process could lead to what we call congenital hearing loss. And during the course of delivery of a baby, if the procedure does not meet expected standards, something can also go wrong during birth and leading to hearing loss, such as birth asphyxia, in which case there is a prolonged delay of the baby's stay in the birth canal before coming out and is unable to receive adequate oxygen. That will lead to some damage of this sensitive organ. If, for instance, the mother was also sick during the course of conception, there are some certain infections that can pass through the placenta and even affect the baby that is unborn. And if certain drugs were taken, the drugs we call ototoxic drugs, including herbs, the contents are not known, so it is possible that this can be injurious to the brain and also injurious to the ear. Let's not forget that we hear through both our ears and through the brain, because the ear transmits this sound and changes it from sound energy, mechanical energy, to electrical impulses that are transmitted to the brain. There's a certain part of the brain that now interprets what the individual hears. So this pathway can get injured during the course of baby developing and also giving birth. And after birth, it's not yet over. Even very commonly, some children will come down with jaundice. So jaundice, if poorly handled, is also known to be one of those, situations that could affect the ear and the ear system, leading to hearing loss in such children. And this is why it's very, very important that every newborn must have hearing screening before leaving the hospital. The first year of life is very important because it is within this period that programming of sounds that is picked from the environment by the brain is done. So if a child is unable to hear within this critical period, that part of the brain that's observed for programming of hearing can undergo what we call plasticity, which means it starts degenerating and going down, and it becomes very difficult at that instance to be able to bring the child back to the normal level of hearing. So you can see children, they are very prone to this problem. And even common infections that children may have at early part of life can lead to this, including meningitis and their likes. Okay, certain drugs that are given to them, like some anti-malaria, quinine, and certain drugs like the one we call aminoglycosides, which are commonly used in treating these children, can also lead to this problem. So children must be immunized. Mothers must be well taken care of, right from the time of conception to the time of delivery and even beyond, so that we'll have a sound child and a sound baby. And before they're enrolled into school, their hearing should also be screened to be sure that the child is very sound to be integrated into the society.
Okay, having mentioned all of this, how aware, what is the level of awareness out there? If, for instance, in hospitals, as you just said, when a baby is born, hearing screening needs to be conducted. How aware are the hospitals, especially in our country?
Well, it takes two to tango. So every facet of our economy is affected. So the health will not be an exception. For that reason, we have a lot of deficits. It is true that there is a policy existing to ensure that this is done for every newborn child. But I can tell you that most of the hospitals, either they lack the capacity to do this, or that the simple equipments to conduct this hearing screening is not available. We need what we call the autoacoustic emission. It's not too expensive that we can't afford it. And we have the one we call automated brain response audiometry. So these two pieces of equipment are necessary to be able to safely screen children that are delivered in all our hospitals. So that means that we need this to be, available in hospitals, and especially places where antenatal and baby well care is taken care of. The list will be to make it available at points of immunization to ensure that, if not for anything, this is done during the course of immunization of these children.
Yeah, this brings me to the question, you know, that in 2018, Nigeria formulated the ear healthcare policy.
Correct.
To basically take care of hearing care at all levels. So how effective has this been?
Yeah, it took a lot of effort to get this policy on track. World Health Organization, indeed the United Nations, first rolled this out in 2016, and they made it mandatory that every country should adopt this because of the benefits generally to the entire country and indeed to each and every one of us. So 2 years after, it took our society and individual efforts to be able to get this on track. We're able to get organizations that supported the Federal Ministry of Health, you know, to be able to pass this. And some of us featured in the team that rolled this out. Under the leadership of the then Health Minister, Professor Isaac Folorunsho Adewale, this was launched. But after the launching, the implementation committee was put in place. But I'm not sure that they've been empowered enough to be able to enforce this. So our problem right now is more of implementation. Recall I've mentioned that there are basic tools that are needed, you know, to be made available for us to be able to, you know, carry on with this course and champion it efficiently and effectively. So we need to really put in more effort to see that this is really in action, and it really permeates to every nook and cranny as it is expected, both the tertiary, the secondary, and the primary health care in our country.
So being someone who has been in practice for many years, so what could you say is the situation with the needed human resource for this area of care? This is against the background of the 2023 World Hearing Day, which re-echoed the need for ear care to be integrated into primary health care. So what do you say is the situation now?
The situation is a very bleak one. It's very unfortunate. The human resource in the healthcare sector in Nigeria has been diminishing. And no thanks to the mass exodus which has happened within the last few months and last few years in our country, and it's still happening. The so-called Jagba syndrome, you know, is on. People are living in droves. Initially, the doctor-patient ratio in the country was put at 1 in 5,000, as against 1 in 600 as recommended by WHO for you to have an effective healthcare system. But today, it has dipped and dropped to 1 in 10,000. So you can see the far cry was so much, very much away from the expectation. And we're talking of the general doctor-patient ratio. ENT, otorhinolaryngology, is a highly specialized, a super specialized, so to speak, specialized area that all over the globe you have deficits in the required number. So you can imagine how bad it is in our country today. So we have very few ENT surgeons who are available in the country to handle the enormous responsibilities entrusted on them. And this care is not limited to children. It's across board. When we talk of the young adults, as you rightly cited in your intro, at least 1 billion are at risk of significant hearing loss, preventable hearing loss across the globe. And these are mainly due to lifestyles and socials, which brings to the fore the issue of safe listening. The youth, they are in the very fast track and fast pace. It's a technological driven youth that we have now, society. And a lot of them, you see them 24/7 wearing earpiece. and this earpiece is really dangerous when it is worn for a very long time because it completely occludes the canal of the ear and channels the entire sound directly into the ear to an injurious level that this affects these sensitive organs that we're talking of in the ear, specifically the external hair cells, which are very sensitive, and the organelle, which converts the sound mechanical energy to electrical energy, as we have talked about earlier on. So this group are really very much at risk. And let's not forget that they are the group that are also very active and lays a lot of credence to socials. So these are the groups that you see in clubs, in very noisy background and environments, trying to. And again, our society in Nigeria is one of those that celebrate almost everything around us, ranging from the birth of a child down to the death of an adult and even very elderly ones. So this is always emasculated with a lot of noise and background noise and to the level that is injurious. You talk of our worship centers, the same thing. We have megaphones all over, which rams and rams from morning till evening, and you go to marketplaces, it's always very noisy. You go to recreational facilities, always laced with so much noise. And these are really, really very injurious because they lead to noise-induced hearing loss, which up to this moment I can tell us for free that the rehabilitation is very, very difficult. You talk of the aged ones, the elderly ones, at certain age, it used to be up to 50, 60, but now we know that from 45 years downwards, individuals start getting predisposed to what we call presbyacusis, which is age-related hearing loss. With the global trend of longevity now, so you're having many more people who are prone to developing this. Less with the noisy environment that even worsen the situation. And of course, here in Africa and in Nigeria, almost everybody is a doctor. So sure. You prescribe, you see all sorts of herbs everywhere. The content of these are not really verified. And most of them have toxins that are injurious to the ear and to the ear apparatus and hearing. So if you screen a lot of people walking around the street, you realize that a good number of the populace really have significant hearing loss. And this is why WHO recommended that minimum every individual should be screened once in a year, but desirably twice every year. You should have your ear checked, to be sure that everything is in order. And if any harmful effect is detected, so it will be detected early, and the chances of rehabilitation will be high.
Okay, now, Prof, this brings me to this question. In our society today, let's say to belong, how safe is the use of earphones, earpods, all these ear devices? Especially not just among the young these days. You see elderly people too. Someone is walking in the streets, they have the AirPods on, they have the earphones. So talking about the sensitivity of the ear to noise, the eardrum to noise. So how safe are these devices to the ear?
The question you raised is a very critical one, and I alluded to that. And to show how significant this is, some few years back, safe listening was the theme that WHO floated about 2 years ago or thereabout, when it was realized that the picture you have painted is really a very big problem, which predisposes a lot of people to developing hearing loss. The preaching here, everything in moderation. We wouldn't say that earpiece should not be used at all, but it should be used in moderation. And if one may lay hands on the one we call the earphone, the type you commonly use in your studio that is like a cup, that is safer than the pin-like one that completely occludes the ear canal, which is the earpod and the earpiece. The headphone is safer because it doesn't completely occlude the canal, and all the sound coming in from there are not really channeled as it is done when you use the other two, you know. And when we're using this, let's try to tone down the volume, and intermittently we'll remove it. Unlike what you may realize, that is why emphasis is so much on, you know, the young adults, because they can wear this 24/7, studying, reading. Some will even go to bed wearing the same earpod and having so much sound, you know, being channeled in their ear. So as much as possible, this should be avoided. If you must not avoid it, then it should be used in moderation. That's what our advice will be. And the other thing that is related to that is the one we call the, you know, the ear, what's it called again? Bud. You know, yeah, the earbud. Yeah. So you know, people want to clean their ears. Okay. So want their ears to be clean. But I can tell us that those stuff are not meant for the ears. The ear needs no cleaning. The ear cleans itself. In fact, it is primarily meant for the removal of crust from the nose, so that we don't have to insert our fingers into our nose. So you use those cotton buds to just pick the crust from the nose. It's not meant for the ear. Okay. As a matter of fact, it's supposed to be written not for the ear. If you go to very sane clime and where rule of law is strictly maintained, you see where it's inscribed on those things, not for the ear. And we have been campaigning on this over time, that please, all the cotton bud imported in this country or manufactured here, it should be boldly written that it's not for the ear.
Okay.
Yeah.
Okay, now, thank you very much, Prof. In Nigeria here, how do we bridge the gap that we have, especially as we strive to meet the universal health coverage targets?
Yeah, the universal health coverage is a fantastic one, and every country is encouraged to strive and get there, because that's the only way that we can, you know, kick out diseases, infections, infirmaries within our environment. And prevention is very important, which is why what we're doing now is critical, which is enlightenment program. You know, information is power. So we should spend more time to educate the populace on those common practices which predispose them to developing these problems, so that we prevent these diseases rather than allowing them to happen before we start struggling to, you know, mobilize resources towards catching up with them. So a lot credence should be laid to prevention. Then adequate resources should be provided. Minimum, as Nigerian has signed some years back in Abuja here, 15% of the health budget should be dedicated, of the entire budget for the country should be dedicated to health, minimum. That is what is needed for us to have a serviceable healthcare service.
Okay, when I saw the image of the ear here, I was thinking you were going to do some demonstrations for us.
This is a gigantic ear, brilliant ear, to, you know, elucidate what we're celebrating today, which is World Hearing Day. Okay, so this is the pinna, which is the one that is decorated by females. You have several perforations and ornaments there, which a lot of people refer to as ear. So that's what is practically observed, is to collect sound. From here, we enter into the external auditory canal. The external auditory canal is where people insert this cotton bud and clean. And we say today is a no-no. You don't need to clean your ear. All right. From the canal, the sound now moves to hit the tympanic membrane. Tympanic membrane is the eardrum. You can hear people saying that their eardrum is perforated. So that is the eardrum here. So the eardrum collects this sound and magnifies it, and is transmitted through these tiny bones, which are the 3 bones of the ear. From there, this sound energy from here is changed to mechanical energy. Okay. So the mechanical energy is now transmitted to the inner ear that have fluid in abundance. And once it's transmitted in there, that is where we have these hair cells we talked about. And they are able to now change that mechanical energy into electrical energy. The electrical energy is conducted through this nerve. This is a very big nerve. So this stuff like stick here is the vestibulocochlear nerve. So this is the cochlear system, which subserve for hearing, and this one is the vestibular system, which subserve for balance. That is why the ear is both organ for hearing and balance. So from here, this electrical energy is now transmitted directly to the brain, where interpretation is done, and we're able to understand what is being transmitted. That's why it is said that we hear through our ears and also through the brain.
Thank you very much, Professor Ibekwe. That's a very educating one there.
Thank you for having me.
That does it on this episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload and past episodes of the program. Email us for your comments at healthoptions@nta.gov.ng. I am Uche Ugochukwu. Thanks for watching. Goodbye.